Once you've rehearsed correcting the foot and ankle, you can begin dressing the foot. Apply 1 layer of stockinette. Make sure it extends from above the knee to past the end of the toes to protect the patient from the casting material. Apply a 2nd layer of stockinette. Next, place a channel buffer strip on the anterior of the leg and foot. It should extend above the knee and well beyond the end of the toes for full protection. Tape the buffer strip in place. Now you're ready to cast. Put on your gloves. Fiberglass casting tape needs to be soaked in warm water for 10 to 15 seconds to activate the adhesive. Squeeze out the excess water, and with the tape coming off the bottom of the roll, start wrapping at the midfoot. Wrap to the toes, making sure each wrap overlaps the previous one so they adhere to each other. To accurately capture the foot shape, make sure you wrap snugly without squeezing too tight, especially at the toes. Once you've finished the toes, sweep back to the midfoot so that you can continue up the leg. There are special considerations for the instep, and we'll come back to that in a minute. As you wrap the leg, be careful not to wrap too tightly. This can reduce the leg volume and create poor brace fit. Let's look more closely at the instep. As you wrap the instep, you want to get full coverage on the heel without creating too many overlapping layers on the instep. If you wrap over and over in the same place at the instep, the material will become too thick and hard to cut through. And it's really easy to not get enough overlap when wrapping the heel, which can result in a hole. So at the instep, try to have minimal overlap, and at the heel, make sure you get enough overlap. Once you've completed wrapping, you can focus on positioning the foot and ankle. This is a repeat of what you rehearsed earlier. First, correct the heel, positioning it as close to vertical as the patient can achieve. Next, while holding the heel position, correct the forefoot to as close to level as the patient's range will allow. If the patient can't achieve a level forefoot with the heel held vertical, prioritize the heel position and allow some forefoot varus or valgus. Finally, position the ankle by sliding the foot back to the desired ankle angle. As the tape begins to cure, use the tips of your fingers to push in around surface anatomy like the malleoli, Achilles tendon, and around the base of the fifth, so they're clearly captured in your cast. Once the tape has cured enough to hold its shape, you can remove the cast. Start at the top with your hook blade knife. If the very top edge is too thin to get a good cut, come down about a ½ inch where the material is thicker. Put the hook in at a slight angle and cut downward, staying on top of the buffer strip. If you get stuck at the instep, work through the layers by carefully making a few passes. Continue down the dorsum, slowing down at the toes. It can be easy to zip past the end of the toes and risk cutting your other hand. Pull out the buffer strip. Use your medical scissors to cut the top layer of stockinette. Gently open the cast and lower it off the foot so that you don't bend and wrinkle the back of the heel. While the cast is curing, it needs to be held closed to maintain the shape of the foot and ankle. Electrical tape or staples work well for this. If you'll be scanning, use light-colored tape. Make sure the edges of the cast touch but don't overlap. Write the patient's name on the cast. Once the cast is complete, it's important to do a quick evaluation to make sure it will be a good foundation for a well-fitting and functioning brace. Is the cast in the position you had planned? If not, you're not likely to get as good a fit. There's a lot of guesswork involved when you want the brace to be in a position that's very different from your cast. Is there complete coverage from top to toes? Is the wrap smooth and even? Is the surface anatomy well defined? If your cast looks like the one on the left, but you intended it to look like the one on the right, the best thing to do would be to recast right then and there. It will only take you a few extra minutes, and the end result is going to be far better.